Mouth ulcers, they're tiny little things but can get really painful. In today's video, we're going to go through everything you need to know about mouth ulcers. Let's get straight into it. Mouth ulcers, also known as canker sores, are small painful sores that pop up in the mouth. They can appear anywhere inside the mouth, including on the inside of the cheeks, the tongue, the gums, the lips, and on the roof of the mouth. They can be white, yellow or greyish, surrounded by a red rim. They can be painful and can make it hard to eat or brush your teeth. The main cause is an injury, such as biting the inside of your cheek. Other things that can cause injury, including burns, something sharp such as a broken tooth, dentures, braces or toothbrushes. It can also be caused by acidic foods, stress, hormonal changes, certain medications, certain medical conditions, and also nutritional deficiencies such as vitamin Bs, folate and iron. They're not contagious, so you don't need to worry about spreading them to others. In most cases, mouth ulcers will heal by themselves in 1 to 2 weeks. But if you want to treat it quicker, here are some treatments you can try. Firstly, for a non-medicated option, you can try a saltwater rinse. This is a cheap and effective solution to get rid of those mouth ulcers. Mix half a teaspoon of salt in a glass of warm water. Now just make sure the water is not too hot. Swish it around your mouth for about 30 seconds and make sure you spit it out. This will help to heal the ulcer by killing bacteria and reducing inflammation. Avoid irritating foods such as spicy foods, acidic foods, or rough textured foods. These can all exacerbate the ulcer. Now the type of treatment depends on the location of the ulcer. Treatments usually come in the form of a mouthwash, gels, pastes and liquids that you apply to the area. The ingredients you'll usually find in these include local anaesthetics, anti-inflammatories, corticosteroids and antibacterials. Now if the ulcers are at the back of the mouth or in hard to reach areas, it's best to use an alcohol-free mouthwash. Avoid alcohol-based mouthwashes as the alcohol can cause irritation and burning to the ulcer. These antiseptic mouthwashes can help to reduce the amount of bacteria in the mouth, which can help to heal the ulcer and prevent infection. You can also get a mouthwash which contains a local anaesthetic such as benzocaine, which can help to numb the area and reduce the pain. For mouth ulcers in more easy to reach areas, you can apply a liquid, a paste or a gel directly to the area. The gels or liquids may contain a local anaesthetic to numb the area, such as lidocaine or lignocaine. You can also find an anti-inflammatory such as benzidamine or choline salicylate to help reduce the inflammation and pain. They generally also contain some antiseptics such as these ones to help kill the bacteria. The gels and liquids just need to be applied directly to the area and repeated multiple times a day. Refer to the product packaging for directions. Other available mouth ulcer treatments are in the form of a paste. These are applied topically, but unlike the gels, they form a sticky layer on top of the ulcer after you apply it. This is to help protect the ulcer from further irritation or injury. You can get the paste just by itself without medication, or you can get it with a corticosteroid such as triamcinolone. The corticosteroid can help to reduce the inflammation, while the paste itself will form a layer over the ulcer and help it to heal. Apply the paste by dabbing it gently onto the area so it forms a thin layer over the ulcer. If the mouth ulcers are still very painful, you can take some oral analgesics or anti-inflammatories such as paracetamol or ibuprofen. These can help with the pain and inflammation associated with the ulcer. The other clinically effective treatment to help treat the ulcers are vitamin B tablets. There are some products which contain a few of the different vitamin B vitamins, and this can help to reduce the duration of the mouth ulcer. Whilst mouth ulcers are generally harmless and resolve on their own, it's important to know when to seek medical advice. The ulcers are unusually large, persist for more than 2 weeks, are accompanied by a fever, cause severe pain, take any medications or have any medical conditions, then make sure you speak to your healthcare provider. For recurrent mouth ulcers, it's really important to understand the underlying cause. Speak to your healthcare provider to rule out any nutritional deficiencies or any other underlying causes. Tip number 1, maintain good oral hygiene. Brush your teeth and floss regularly, and use a soft bristled toothbrush to avoid injuring your gums or your mouth. Tip number 2, avoid any foods that are too spicy, acidic or rough, as these can irritate the mouth. Tip number 3, stay hydrated to keep your mouth moist. Tip number 4, manage stress through relaxation techniques and exercises. Tip number 5, consume a balanced diet. This will help to reduce the chance of you having any nutritional deficiencies, but make sure you correct any nutritional deficiencies with the relevant supplements. Tip number 6, avoid chewing on sharp objects. Sharp objects can damage the tissues in the mouth. Tip number 7, use a toothpaste without sodium lauryl sulfate, also known as SLS. Sodium lauryl sulfate may weaken the lining in the mouth, which can make you more prone to mouth ulcers. Tip number 8, check for any food allergies or sensitivities that might be exacerbating your mouth ulcers. Now that comes to the end of our video. If you found this helpful, then please give it a thumbs up. If you want to see more videos like this, don't forget to subscribe, and we'll see you next time. Bye!